Hi, everybody. This is Dr. Lee from Lee Acupuncture. And today I want to interview the Priscilla. When I heard from the HRC, one of the biggest organization in this Southern California for fertility clinic, they have a special person helping their emotional stress. I wanted to hear and what it is about because I think that is just so important. So thank you so much for being here, Priscilla.
Yes, thank you so much for having me, Dr. Lee. It's a pleasure to be on here with you and with all of your viewers.
Oh, that's lovely. So let me introduce Priscilla Rodas Huertado.
Mhm.
So Priscilla developed and then implemented the emotional wellness program at the HRC to incorporate emotional support throughout the patient's fertility journey. She is bilingual, licensed clinical social worker who received her undergraduate degree from California State University, Los Angeles. She got her graduate degree from Azusa Pacific University and has over 8 years of extensive training in the field of mental health.
Yes.
Her main focus is delivering culturally sensitive, trauma-informed, affirming, and client-centered services using evidence-based practice. How beautiful is that?
Thank you. Thank you. It took definitely lots of years to acquire all that experience, but it's been definitely very, very worth it. I
Oh,
definitely enjoy what I do.
I hear you. So before I go further, because before actually the interview, Priscilla wanted to hear about just briefly how I help the patients in acupuncture and Oriental medicine. Because I I believe acupuncture is a very old medicine at this time, like over 3,000 years old. So people know already how it works, but sometimes surprisingly people doesn't understand. So I want to briefly explain what I do and why I think Priscilla's services are so important at this time. Acupuncture, as I said, is like a 3,000 years old worldwide. People widely using it at this time to lower the inflammation. So pain management is initially people start interested in acupuncture. But right now we are 2021. Everybody has a stress.
Mhm.
Everybody has a problem with the hormones. And there's a various factors causing all these health challenges. So acupuncture and oriental medicine include biology in helping people in looking at the whole person approach and not only focus on the physical part of health. Uniquely, Oriental medicine look at the people's emotion as a huge important factor to balance your health. So basically, if you have a lot of sadness during this journey, we think it will help. It will cause actually some problem with your upper respiratory problem, like lungs, or you got frustrated, or you worries a lot. Then it causes a lot of GI related problems. So I'm really seeing specific emotion and then specific organ dysfunction. So if Priscilla or all this great help can emphasize and then it will rebalance your organ function and then magic happens. But that's why I think it's a very important agent service together to make this journey complete and more successful in a short time. It's possible. Does it make sense, Priscilla?
Yes, it does. It does. Thank you so much. I agree with you. Um, there's just so much study, so much research to show how stress impacts people's just daily lives, daily functioning, and obviously their physical and their emotional health. So I'm all for adding all of the resources that you can to improve your chances of conception, but also just improving your emotional well-being, your physical well-being. So I definitely understand what you're saying, Dr. Lee. And I think acupuncture is so beneficial, not just when you're going through infertility, but just going through life, because it has so many stressors. And so I think it's such a great resource to utilize.
Oh, I appreciate it. But you are the highlight of this interview. So let's dig in and then see what the Priscilla has for. So
Yeah.
can you tell briefly about your service and your practice?
Yeah, sure. So my practice is here out of HRC Fertility. We are located in kind of all over California, but I'm out of our Pasadena office.
Mhm.
And HRC is one of the leading fertility groups in the world, and so I'm so honored to be here and doing what I love to do. Here at HIC, we have seen firsthand how stressful, how traumatizing, how anxiety provoking infertility can be.
Mhm.
We see the implications of stress on our patients, not just on their physical well being, but on their emotional well being. And we see how, unfortunately, we see how difficult the journeys can be for our patients. And
Mhm.
so, last year, we decided to create this program to help our patients kind of just navigate infertility, the stressors that come with it, the anxieties, the worries that come with it. So a little bit about what I do here at HRC Fertility is we have a very client-focused treatment plan where we get a referral from their nurses or their doctors, and then I do an intake appointment with each patient to talk a little bit about what their struggles are, and then we come up with a goal. So for example, a goal can be, I would want to reduce my stress from daily to maybe once a week or twice a week, and then every session we work towards that goal. We also provide emotional check-ins before and after procedures because that can be a really stressful time. We provide couples counseling, because a lot of couples have some difficulties with communication or just, sharing their experiences with one another. So we do that. We provide a bunch of tools and resources um, on coping strategies, on holistic health, diet, try to consider the patient as a whole and how we can
Mhm.
support them navigate infertility. And what we do here is that we provide 7 free sessions. So that's 7 weeks of free emotional support. And again, that's can be, weekly, could be bi-weekly, depending on their schedules. And yeah, we are so excited to be able to provide 7 free sessions. And then after that, they can stay on board with me, but obviously it would have a fee, or we can help connect them to someone within their insurance company.
Wow, 7 free
7,
session.
yes, 7,
That
that's
is a
7
lot.
weeks.
I mean, that's lovely. That's amazing. I didn't know
Yeah.
about that actually. Thank you
Yeah,
for
we
sharing
wanted
that one.
to. Yeah, we wanted to do something where we could actually see progress. We can support our patients through the most difficult times of their journey, and so 7 weeks seems like a really good amount so that they can learn
Mhm.
coping strategies and learn tools to help them be successful.
Right. I mean, even the 7 session, they can make a lot of change.
Oh yeah,
That is very generous of actually your organization.
thank
So
you.
yeah, let's go for a little bit yourself. So what made you decide to focus on this infertility?
Yeah, so I have always been a huge fan of reproductive health, women's issues. One of my first jobs actually was an OBGYN / infertility clinic. Originally, I was going to be an RN, and so I I'm going to start my first job as a healthcare worker. So I
Hmm.
kind of just started to get really exposed to infertility, OBGYN, pregnancy, all of that, and I just fell in love with that population. So I did 4 years of extensive training there at the OBGYN / infertility clinic. And, I really got to see the full circle, right, of the struggles that someone has to conceive and then how that translates to pregnancy and how that translates to parent-child attachment. So I wanted to do something with my life where I could help with preventative measures. Like, how can we help a parent be healthy so that when they do get pregnant, they have a healthy pregnancy and then have healthy parenting at the end. And so that's why I really got into infertility. I had been searching for a while, infertility clinics that offered this program, and
Hmm.
it took me a while to get to where I'm at. But I'm so excited that HRC is like, we see the need, and now we're here. So that's a little bit about myself and why I just love infertility. I love preconception work. I also help our patients, if they do get pregnant, help them through pregnancy and then parent-child attachment strategies.
Because you work at the regular OBGYN, now you're in the infertility clinic. So you actually look at the whole picture, even as you said, the healthy pregnancy part as well. That is a great experience. Thank
Yes,
you.
thank you so much.
Sure. So through your experience, like seeing this is so many patients over the years, and then what have you seen the biggest struggle that many people or couple or experience with this fertility journey?
Dr. Lee, there's just so many things that come into my mind because I work with so many different patients. But here's what I think. Infertility is stressful, period. There isn't one person that I have met that isn't forever changed or forever touched by infertility. It is just extremely stressful. People grieve so much when they get an infertility diagnosis. They grieve a bunch of things like their imagined family fantasies, dreams of building their families. And with every period, there's a grieving process. And so what I see a lot when I get a patient is definitely people dealing with depression and anxiety to the point where it impairs a bunch of things. It impairs their relationships. And that can be with their spouses. So a lot of communication challenges, a lot of difficulties understanding each other. And a lot of times we see that they're kind of on different pages when it comes to treatment. So definitely relationship challenges is probably one of the things that I see a lot. And then also issues with their relationships outside of marriage. So like with family and friends, because a lot of times what we see is a lot of isolation when it comes to infertility. And what I've seen through my research and just a bunch of research that has been done is that there is a lot of shame and guilt that comes with infertility. There's a lot of blame that we do on ourselves or patient selves that triggers the anxiety and the depression related to infertility. So kind of the things that I've seen is an increase in depression, an increase in anxiety among folks that are infertile. And then I think another thing is that people don't see how stress, depression, anxiety impacts their fertility. One of the things that I try to tell my patients is when we're stressed, chronically stressed, right, our initial stress response, which is fight, flight, or freeze, is overactive, right, because we're going through so much stress. And so when that response is overactive, our hormones are all over the place, such as like cortisol and adrenaline. And all of these hormones impact our reproductive organs, right? They impact our menstrual regularity, they impact ovulation, they impact sperm quality, just a bunch of things. So what I would want to tell my patients or people just thinking about fertility treatment is the importance of holistic, healthy coping strategies while they're going through infertility treatment is so important. And we'll get a little bit about why, but that's kind of one of the things that I see. I see a lot of depression. I see a lot of anxiety. I see a lot of marital issues, a lot of isolation, guilt, and shame that come with the journey.
Unfortunately, even I'm seeing like especially male factor, and the men, if they are anxious, they have more challenges with this fertility journey. So I don't know, this make people anxious, but also anxiety is initially they're brought them to the actually this male factor and challenges. So that's why they really need you help. That's why we need you, Priscilla.
Yes. And what I also see too is when we're stressed, we tend to make poor choices. So a lot of times people who are stressed, they might, eat a little bit more unhealthy, or they might consume more alcohol. They might smoke more. They might engage in other risky behaviors that are going to kind of furthermore impair their fertility.
That's a great point. And then you said that you do also like a help some diet with some healthy choice during this journey. I think that's very valuable. Excellent.
Yeah.
So, is there any like a myth about this? Like any biggest myth about the fertility?
Oh yes, so many. I think one of the ones that I get a lot is that infertility is a woman's issue. I get that a lot.
I just said male factor.
Oh my gosh, when we look at research, right? 30% is, yes, female attributed, but the other 30% is male attributed. So we have the equal, I would say the equal kind of reasons why, we might be going through infertility. So just as women have, female factors, we have male have male have factors as well that contribute to infertility. So it's kind of like an equal, experience when it comes to infertility. So if people
Exactly.
have that myth that it's just a women's issue, that's a misconception. Men and women are equal when it comes to the factors that relate to infertility.
You're during the consultation, actually the like a partner or husband, they coming with the wife too? Is it
Yeah.
very, also they do. I'm glad to
Yeah,
hear that.
it depends. Like some, unfortunately, I feel like it takes a lot for the men in the relationship to come and want to participate, but there are a bunch that do enjoy it and they do learn a lot from it. So yeah, I do have, like, I would say like 50% of my patients come with their couples and then 50 is just the female.
I see. I see.
Yeah.
So go ahead.
Another myth that I want to talk about is that health doesn't impact fertility, and I
Oh,
think that's one of the biggest things that we see, when we think about or when we work with people going through infertility. Lifestyle is a huge factor when it comes to fertility. Research shows that like 85% of infertility can be treated with conventional therapies or just lifestyle changes. And so I think it's so important for people to know that, yes, your lifestyle can be correlated to your infertility. So, making those really awesome lifestyle changes that,
mhm.
we'll talk about a little bit after is so, so important. So if you're thinking that, smoking or, drinking too much alcohol or drinking too much caffeine doesn't impact, it actually does.
I totally agree with you. In our clinic, we always go over life factor, like let's say exercise, diet, or stress management, and then how about hydration and sleep? They all impact, and I totally agree. So I guess we are both agree, but why is it so important to look at your health holistically when it comes to fertility? Because you shared a lot already though.
Yeah. So again, going back to like that 85% here in the US of infertility cases can actually be treated with conventional therapies, and then lifestyle changes. So first, let's talk
Wow.
about lifestyle changes, and then we'll talk about conventional therapies and then more. Things like maintaining a healthy diet are so important, like incorporating, well, typically here at HRC Fertility, a lot of our physicians will prescribe a Mediterranean diet. And
Mm-hmm.
what that looks like is like half of your plate is vegetables, right? And then like 1/4 is protein, and then 1/4 is like healthy carbs. And so we like to teach kind of like a healthy diet, what that looks like. We like to give samples of veggies and nuts and avocados and things like that. But actually maintaining a healthy diet is so, so crucial to preconception health. And then also maintaining a healthy weight is really, really, really important. So we look at, like, there's just a bunch of research that will show like people who are obese have a hard time conceiving, either on the female side or the male side. They can both contribute when they have an unhealthy BMI or unhealthy weight. Um, Other things, for example, like using appropriate supplements. So,
Mm-hmm.
typically here at HRC, we'll try to cover supplements, and, we'll try to do as organically as possible, but we try to go for like vitamins, prenatal vitamins and things like antioxidants and things like that, that can be really helpful at increasing your chances of conception. Other things are, being more mindful about toxins that we put into our bodies, things like beauty products and certain foods and certain household items that contain things like pesticides and formaldehyde, things like that are in plastic containers, things that are like in air fresheners, like all of those can actually be tied back to difficulties with conception. So those are some things when it comes to like lifestyle changes. Also, in getting enough sleep is so, so important. I can't stress that enough. There's so much studies to show that when we don't have adequate sleep. Things like adrenaline, cortisol, and insulin are kind of just really elevated or really low, and that can really make it hard for conception. And then, things like avoiding caffeine, alcohol, smoking, getting routine physicals, routine STD, sexually transmitted disease checkups. And then probably one of my favorite is improving your emotional well-being before, but also during fertility treatment, because it's so important to be able to manage stress as you go through the journey, because stress itself can really be harmful to your hormones that are essential to conception. And then,
Mm-hmm.
things like conventional therapy. So you don't just have to go straight to IVF. You can do things like, regulating your hormones just through exercise and diet. You can look at medicated cycles, so obviously looking at how to improve your cycle, and then maybe one or two medications that could be helpful at increasing your ovulation or improving sperm, before having to go through really extensive and invasive treatments like IVF. You can do other things first, and those have been proven to be really helpful as well.
Thank you for letting me know. That's exactly. I mean, we step-by-step approach, and then
Yeah,
if you can do more natural or a little bit of help with the medication, and eventually IVF if necessary, I think a definitely great idea. So,
yeah.
what should the people know when they're considering this infertility treatment? Since you're working at the infertility facility place.
Well, the first thing is, if you're considering fertility treatment, is think about lifestyle changes. Um, you know, Probably a little bit before, but then obviously during fertility treatment, it's looking at, like, do I have a healthy weight? Do I have a healthy BMI? Can I be incorporating more exercise? Exercise is so beneficial to not just your fertility journey, but also at managing stress, because it helps with endorphins, and that can really help with stress management. Um, Also things like exercise, like healthy nutrition. You're thinking about, like, also how can I improve my stress levels, so that can be through like yoga, meditation, acupuncture. It could be through joining a fertility group online. That can be really helpful as well as informative. So that's one of the things. The other thing is, if you are thinking of starting a fertility treatment journey, is making sure that you find an expert in reproductive endocrinology. Also finding one that is knowledgeable and that is up to date on technology. That's probably going to be my recommendation. And then also finding a physician that is compassionate, that considers your values, your beliefs, your morals, that aligns just with you and who you are as a person, is going to be really, really important. And you can find that here at HRC Fertility. Yeah, and then the other thing I want to add is, if you are considering, fertility treatment or thinking about getting pregnant, don't wait too long to talk to your doctor about fertility options. We do see, obviously, the percent of people struggling to have children are older than 35. So if you are younger than 35 and have been trying for a year, get some help. It doesn't hurt to get a consultation. And if you're 35 and older, have been trying for 6 months, or have experienced recurrent miscarriages, please find help. Don't wait till you're, closer to 40, because that can really impact your chances of fertility. Not, a lot, but definitely, being very proactive can be very, very helpful. So that's kind of what I want to say. And then the last thing is, advocate, advocate, advocate. Research, research, research. Be informed, do your own due diligence when it comes to your fertility with your health. I would say ask questions. If you don't like the answers, ask again. If one protocol doesn't work, ask for changes. Like, what can I do differently? What can you do differently as my physician to increase my chances of building my dreams of building a family? So those are some suggestions.
That is a beautiful. I mean, especially up to date, because a lot of changes I'm seeing over the years, especially for our infertility, like IVF protocol wise. And you really nailed it. Don't wait. Timing, timing, timing. That
Yeah.
is
Yes,
so important.
Unfortunately, for men, it's not as much, but for women, age is crucial. We definitely see a drop in the quality and quantity of our eggs at 35 and over. So if you're thinking about it and you're struggling, please contact HRC Fertility at havingbabies.com. Or you can also check us on Instagram and Facebook at HRC Fertility for more information.
Yeah, that's actually, I tried to ask how I can get the information from the Priscilla. So you already share. That's where
Yeah.
people can find out your, and then is there anything you wanna share? Like the one thing during this beautiful, actually you really not only focusing on emotional health, you did all to me. You are so knowledgeable. So you
Thank you.
nailed what's a lifestyle and hormone and then exercise and diet. I really appreciate it. And that holistic view of support is available through you from HRC. I think it's most really needed for a lot of our patients. Is there
Yeah.
anything else you wanna share as the last?
No, if your customers or people are interested in getting connected with emotional support here at HRC Fertility, and take the benefit of our 7 free sessions, they can always just go to our website at havingbabies.com. I have a webpage on there under emotional wellness services. You'll get to know a little bit more about me, my background, and also what we provide here at HRC Fertility. But just know that counseling can be really, really helpful through your journey through fertility treatment. We do a bunch of work on stress management, looking at you as a whole person, not just somebody who is infertile, but pulling out your strengths, trying to find ways to improve your natural fertility, along with just helping you navigate through coping strategies, relaxation, linking you to resources to like the ones that Dr. Lee offers, like acupuncture, massages, things like that can also help promote your fertility. So I am excited to see you guys. You guys can always check us out on our Facebook and Instagram. I do weekly updates on relaxation and coping strategies that can be helpful to your viewers, Dr. Lee.
How beautiful, how beautiful. Priscilla, this journey, as you mentioned, is very isolated and it's lonely. So if you have more people supporting you through this journey, let's say emotional, or your doctor, and then your acupuncturist or other, like you need a team of people well
Yes.
equipped, understand each other, and then just fully support you. I mean, I have no doubt you are that person. So I'm so happy to
Thank
learn
you.
about your service and your
Yeah.
dedication. Thank you so much.
Thank you
And
so much for having me,
I'm
Dr. Lee.
yeah, I'm just excited to see our patients get help from you. Thank you so much for your
Yeah.
time, Priscilla. I
Thank you so much
appreciate it.
for having me. Have a great day, Dr. Lee.
Thank you so much. Bye.
Bye.